comfort, but also about overall physical, mental, and reproductive well being.
Guide us with medical knowledge and practical advice. We have a very special guest with us today. We are delighted to welcome Dr. T.S. Ramya from Chennai. She is currently an MBBS house surgeon. She has hands-on experience across various medical departments such as general medicine, general surgery, gynecology, dermatology, etc. Welcome to the podcast, ma'am.
Thank you. Thank you so much for the opportunity. I'm currently doing my house urgency in PSG, Institute of Medical Sciences and Research, Coimbatore. I'm very glad to be here with all of you today.
Thank you, ma'am. So, can we start, ma'am?
Sure.
Okay. To begin with, could you explain what healthy menstruation means from a medical perspective?
We all know what menstruation is. I really hope this message reaches a whole lot of public, including school children of all societal corners, college students, and whoever is experiencing menstruation as of now. Healthy menstruation is basically regular cyclical shedding of your endometrial layer. This layer is an inner lining of the uterus in every female. So this lining sheds when we all basically know how this works. When there is no pregnancy, usually how our uterus works is there is an inner lining called endometrial layer. This is a lining of to be in simple words, it's a lining of blood vessels which builds up to make the uterus get ready for carrying the baby. So when this doesn't occur, there is regular cyclical shedding. This occurs every month. The buildup occurs every month and it sheds every month. So this is a normal physiological process. This need not necessarily be associated with increased amounts of pain. It should not ideally intervene with your daily activities. That is healthy menstruation. If you want me to define from a very medical perspective, I would say the duration of bleeding will vary from 3 to 8 days. It is very subjective. But 3 to 8 days is a normal duration. Anything more than 8 days, you call it prolonged bleeding. Similarly, the volume loss. Usually, youngsters in our nation, most of them use sanitary napkins. So when you look at your napkin every time it's completely soaked, it looks like a lot of blood is lost, but it is not so. It is just ranges just from as less as 5 ml to a large amount of 80 ml. But on an average basis, we lose only about 30 to 40 ml. So this amount is very normal. This is not going to make a very significant change. This is in regard to volume. So if you lose more, if you keep ideally changing pads every 3 to 4 hours is recommended for every woman. But if you see anyone you know changing pads in midnight, they have such a need to change pad in midnight, they have such a heavy blood loss, then they must seek medical help. So this is also part of healthy menstruation. You should know how much blood is being lost. And then there is irregularity, of course. This is the most common health problem we see in a lot of women. Irregularity, I would say that this is about the duration of the entire menstrual cycle, the length of a menstrual cycle. This is basically the first day of your menstruation till the first day of your next menstruation. This length is ideally 28 days, which is why we say monthly cycle. But the actual range is 24 to 38 days. Anything less than 24 days, you call it frequent periods. And anything more than 38 days, you call it infrequent periods. So this is all about the volume, the duration, and along with that, your mental and social well-being. This should not hinder you from your daily activities. The pain caused should not, cause absenteeism in your workplace or schools, etc. So that is healthy menstruation. Along with this, every woman should know the methods of safe disposal and um, healthy hygienic habits. For example, washing their hands before and after when they change pads, and keeping their surroundings clean, using clean towels, keeping their genital parts clean, etc. and etc. etc. So this is all about healthy menstruation.
Okay, ma'am. So, move to the next question. I want to ask you, what are some of the most common menstrual health issues you observe among young girls and women?
In recent days, if you ask me what are the common health problems, for before addressing the health problems, I would say options of waste disposal. As I said, a lot of youngsters in our nation follow sanitary napkins, but you must, all of them must get the awareness about existence of other, modes like tampons, menstrual cups. Actually, menstrual cups are being used by a lot of women these days. It's being preferred better than sanitary napkins because it is very, very cost effective. Almost, I think the cost of one menstrual cup will range from 300 to 500 rupees. And the expiry of this, it can be used for approximately 3 to 5 years by washing it after every use. Once the menstrual cup, once you place it, it can hold blood for at least 12 to 24 hours. And it's a good, it'll stop the leakage perfectly. It is like it's a very perfect option, I would say. It's very cost effective. But the only thing is, the first time you apply this, you'll have to seek medical help. You'll have to get it done by doctors so that you avoid injuries to your vagina. But otherwise, after that, once you get used to using a menstrual cup, I think it's becoming very easy. So options, I think there should be enough awareness about options, because sanitary napkins these days are very, very costly, and they also cause rashes. So that is one major issue I have seen amongst a lot of people, and they've also asked me questions regarding these. The next is, we all know, one is pain and one is prolonged bleeding. Pain in periods, we call it dysmenorrhea in medical terms. So when everyone says cramps and pain in periods is common, it's not something that you can take easy. Uh, Usually, a little amount of pain is expected. In fact, even a moderate amount of pain. This can be very subjective. It is due to release of something called prostaglandins. This is going to make your uterine contract, and this contraction is only making all the blood get released. So this is the mechanism behind the pain. But if there is any other underlying cause, like a polyp, or there are so many small medical conditions like fibroids, polyps, and ovulatory dysfunction, which we all know commonly termed as polycystic ovarian syndrome. So these are the common problems I have seen people face. So if anybody is experiencing extreme pain that is causing absenteeism in their workplace or schools and hindering them from even walking or doing any kind of physical activity, then they definitely must seek medical help. And these symptoms should not be ignored. Otherwise, prolonged bleeding is also another important symptom that we should not miss. As I mentioned, the duration of bleed, if it's the 3 to 8 is fine. If it goes more than 10 to 15 days and you notice this in every cycle, then you should definitely seek medical help. These are the common problems we see.
Okay, ma'am. So move to the next question. I want to ask you, how important is menstrual hygiene is preventing infection and maintaining reproductive health?
Yes, it is very, very, very important. A lot of you would have heard something called V wash,
Yes.
but medically, we none of us would recommend that, because our body is such a beautiful. It has such a beautiful make. It handles everything by itself. The vaginal area and the genital area has its own pH, by which it is maintaining some amount of basic bacteria that grows there. So that is not going to cause you any infection. But when you are not hygienic, when you have unclean hands and you change your pads, or you place one pad and you keep it for a prolonged time for like more than 4 or 6 hours, um, and this dampness is going to cause growth of fungus and more and more bacteria. And even using damp panties, damp bottoms, anything can lead to this. So we should make sure the place is dry. And before and after use, please use soap. That is the main thing. More than that, you need not use anything as like a V wash. The what we would recommend is just soap and clean water. That is enough. So this is the basic thing you should follow in case of hygiene. If this is not being followed in chronic terms, like if you're not following this and you're like, okay, it's fine, we can change. After like 2 to 3 or 4 months, slowly infections may start developing. Initially, it may develop only locally in like vulvovaginitis. These are all in the outside. like a skin, it starts like a skin rash and then it develops into infection. And you will, the symptoms would be small pus discharge, white discharge, a greenish discharge, yellowish discharge, etc. The problem arises when this practice is being chronically followed. So what happens is ascending infection occurs. This is going to ascend into your cervix, into your uterus, into your fallopian tubes, and finally to the ovary. So this can also ascend in chronic stages to your abdomen. We call this as pelvic inflammatory disease. One very important symptom that will give you a signal that something like this is happening is a chronic abdominal pain. This will happen even when you're not menstruating. So the entire time you'll be having a lower abdominal pain. So that should be definitely addressed. Should be, you have to be going to the doctor for this. So this in longer terms, especially in the age of, in the marital age, definitely can be an important cause for infertility because it's going to, hamper with your ovarian functions. So causing ovarian dysfunction, it may lead to infertility in longer terms. This is the main reason we all advise menstrual hygiene, safe disposal, everything must be taken care of.
Okay, ma'am. So, do you think there is enough awareness about menstrual hygiene among schools and colleges?
Um, Compared to 5 6 years ago, I think there is a lot of improvement in awareness, because from schools, colleges, as well as, even my medical college, there is a lot of campaigning and awareness about menstrual hygiene and what are the things to be followed. I would say there can be more and more awareness through, you know TV, social media, etc. and etc. There needs to be articles which should explain the medical consequences in a very legible way that a layman, common man can understand. So I think they can work more on awareness. But as of now, there has been a great improvement. The only thing is, again and again, the focus of people would be the same school and college students of a well to do family. We are still not very sure if it is reaching all corners of the society, because a lot of people still do not know what menstruation is. They still struggle to normalize menstruation, and they still consider it as impure blood, and a lot of stuff like that. So even a lot of people are not aware of options like sanitary napkins. So, and they keep using cloth. This usage of cloth and reusing the same cloths and without, proper washing and all that, will again lead to infections. So I feel there can be little more emphasis on menstrual hygiene.
Ma'am, how can school and parents together promote correct menstrual health education?
Yes, in schools, teachers, parents, actually, a lot of kids do not know when they attain puberty, a lot of girls do not know what's happening. They get scared. This is the time when parents will have to intervene, tell them what normal menstruation is, what is it like. They have to emphasize on the fact that this is a normal physiological process and they need not be scared of anything. And I see a lot of parents encouraging absenteeism. Okay, you have periods, you can take 3 days of leave because it's going to cause you pain. No, there is nothing like that. Ideally, your periods should not hinder with any of your daily activities. So parents should also take care of this. If they see their kid suffering from extreme pain, then they should address their concern and immediately seek medical help. So this is from parents' side. And a lot of girls are shy to express a lot of their menstrual health problems to their parents. That barrier must be broken. So to address these problems, initiative must be taken from teachers as well as parents' side. There is already a good amount of education, menstrual health education in schools. But again, as I said, there needs to be improvement. They have these medical health camps in schools. What I feel is it should have a special emphasis, special days for girls alone, just for menstrual health. I think that will improve the condition.
Okay, ma'am. So, are there any medical myths about menstruation that need to be debunked?
Definitely. We have heard lots of such myths. Medical myths, if you ask me, as I already mentioned, they say it's impure blood. No, not at all. It's a normal physiological process. By excreting this, there is no excretion of toxins or anything. It's just amount of blood that has been caught up there just for the arrival of to survive the arrival of a baby, which is not happening. So that's why there is a regular shedding of endometrium. First of all, general public should understand this. Next will be common questions like shouldn't take a head bath during periods. Actually, all of this does not make sense. Why they say this is general, it's a very general concept. This is not just during menstruation but also during digestion. If you've seen a lot of parents say don't go take bath after you eat food, that's because you've just had food. All your blood supply will be towards your stomach now to improve digestion. So when you take head bath, all your head blood vessels are going to dilate. This dilation is going to cause blood supply towards your head. So that means your central blood supply is going to decrease towards the stomach. So the digestion process gets slower. It's slowed down. So it's the same thing with menstruation also. But this is going to make no significant change. In fact, I would recommend regular bathing, because that is only going to help you keep yourself clean, especially your private parts. So bathing, it's actually a good option. And you would have seen it's this warmth, people keeping hot packs to control pain at the localized site. It is all about the same concept. This heat is going to cause vasodilation there, so it's going to reduce the pain. So this is the entire concept.
Okay, ma'am. So, from doctor's point of view, how does poor menstrual hygiene impact long-term health?
As I mentioned, infections major reason. If there is no proper hygienic practices, am I audible?
Yeah, yes, ma'am.
Yeah, if there are no proper, just a second.
Okay, ma'am.
Am I audible?
Yeah, yes, ma'am.
Yeah. So with regards to hygiene and long-term health impacts, it's the same thing. It is all about infections and infertility. These are the major two problems you see in common in women who are menstruating. So if they don't have hygienic practices in life, this may lead to serious problems like pelvic inflammatory diseases, which in later stage may lead to chronic pelvic pain and infertility. This will even cause recurrent infections, and it's going to affect their psychological health really bad. They'll start feeling something is wrong. They might even confuse it with sexually transmitted diseases, which is going to impair their mental health really badly, because people around them may start, it's we may think it's not a big deal, but when we see patients in real life, yes, it impacts them a lot. So from an early age, helping them have the practice of proper menstrual hygiene is very important.
Okay, ma'am.
even
So,
even when you consider problems like heavy bleeding, and you don't seek medical help in chronic stages, you will realize that patient may end up in anemia, because there's going to be heavy blood loss, and they would have thought it is normal to lose blood in menstruation. So all of these must be addressed.
okay, ma'am. So, what are your thoughts on government program of free sanitary distributing pads and the menstrual hygiene scheme?
Yes, actually, currently in the recent past 5 to 6 years, there has been a lot of improvement. There's been a lot of state-wise and national level government schemes where they're promoting menstrual hygiene. There is awareness campaigns about menstrual hygiene, as well as free distribution of sanitary napkins. So there is a She Pad scheme in Kerala, and there is Beti Padhao Beti Bachao, where they're emphasizing on menstrual hygiene for girls, and so many other such schemes. There is uh, Swachh Bharat mission, where basic disposal criteria are being described, and Rashtriya Kishore Swasthya Karikram, and Udan from Rajasthan. So many such schemes are there. It's actually a very, very good initiative, I would say, because for those who have zero knowledge about how to use sanitary napkins and on a very, very low affordability scales, I think free distribution of sanitary napkins is really going to be of great help. And more such initiatives should be encouraged.
Okay, ma'am. So move to the next question. I have one question that how can healthcare profession and local health workers contribute to breaking medical norms? I mean menstrual tops.
Yeah, so actually, to reach the lower bottom of society, uh, and to the community villages in a lot of places where they don't have access to primary health centers, there are trained um, social health activists called ashas. They are trained particularly to take all these information and give reach make sure this all of this reaches to the community level. So I think that is a very good initiative from the government side. Also, when it comes to medical colleges, we hold a lot of campaigns to spread awareness on menstrual hygiene.
Okay, ma'am. So here is my final question. What message would you like to share with young listeners about taking care of their menstrual health?
Yes, very, very important. This I would also say to all the boys of this nation. Um, all boys, siblings, everyone must know what menstruation is like. There are still a lot of people covering the pads when they buy it from shops. Uh, okay, I will. It's people's personal choice. I understand, but it is not a shame. It's a physiological process. That is the basic message I would like to convey. It's a normal physiological process. Every common woman should understand the importance of menstruation, what a healthy menstruation is, what are the danger signs, and when they should seek medical help, about what they can share to their parents and their friends and teachers, and whatever medical knowledge they have, they should be ready to emphasize on that and spread awareness to others. So youngsters of these days are already very knowledgeable. They are well aware of menstrual hygiene practices, but even now, safe disposal is not being properly practiced. I see a lot of people flush pads in the toilets. So it's ultimately going to affect us in a cycle. So all of this should be considered, and that is the message I would like to give to current youngsters.
Okay. Thank you so much, ma'am, for sharing your valuable insightful and medical knowledge with us today. Your guidance has truly helped us understand the importance of menstrual health and hygiene. Thank you. Thank you so much.
Thank you. Thank you.
Thank you so much, Dr. T.S. Ramya, for sharing your valuable insights and medical knowledge with us today. Your guidance has truly helped us understand the importance of menstrual health and hygiene. To our listeners, remember, menstrual health is a part of overall health. Talking openly, staying informed, and practicing proper hygiene can make a big difference. Let's break the silence, remove the stigma, and support one another. Thank you to all.